Hello, my name is Omete, and today I'll be presenting on children's mental health, a contemporary concern. As we explore this topic, I'd like for you to think about someone you may know who experienced a mental health challenge and imagine how things might have been different if this person had been screened and supported early in childhood. Throughout this presentation, I'll share current statistics, key information, and examples on how early intervention and awareness can make a lasting and positive difference in a child's life. Mental health conditions affect how a child thinks, feels, behaves, and connects with others. These conditions interfere with daily functioning and relationships if not recognized early. According to National Alliance on Mental Illness, 1 in 6 children ages 6 to 17 experience a mental health disorder each year. Half of all lifetime mental illnesses begin by age 14 and increase to 75% by age 24. Childhood mental health has become a public priority. Early detection and intervention are key to long-term outcomes. Without treatment, these conditions can lead to academic failure, social isolation, and long-term health problems. Recognizing symptoms early can change the child's entire life trajectory. Why I chose this topic. I recently got screened and diagnosed with ADHD, and it made me wonder, why wasn't I diagnosed when I was younger? According to the CDC, nearly 50% of children with mental health conditions go undiagnosed or untreated. My goal in choosing this topic was to learn more and understand how to raise awareness. I want to feel comfortable educating families about early detection, education, and prevention strategies to make a difference in their situation. Mental health affects every part of a child's development, from school to family and social life. I want to help reduce stigma and make it easier for children and families to talk about mental health. I aim to educate and raise awareness about the importance of early recognition and intervention. As a future pediatric nurse, I'm passionate about advocating for child wellness and prevention. My goal is to share my knowledge and make a difference for children who may not receive the mental health screenings they need. Common childhood mental health disorders. Mental health disorders manifest and affect children differently at school or at home. Anxiety disorders in children can cause excessive worry and fear. This statistic for the US is approximately 5.8 million. Depression in children causes sadness, isolation, and low motivation. This statistic is approximately 2.7 million in the US. ADHD in children causes hyperactivity, inattention, and impulsivity. This statistic approximately affects 6 million children in the US. Behavior disorders in children cause aggression and defiance. And this statistic approximately affects 5.5 million children in the US. These statistics were pulled from the Screening Effective Healthcare website. Children's mental health impact on the healthcare system. Children's mental health issues have placed a significant strain on our healthcare system. Many hospitals and clinics are now overburdened with increasing numbers of children seeking care for anxiety, depression, and behavior disorders. Emergency departments in particular have seen a sharp rise in pediatric mental health visits. There's a shortage of child psychiatrists and therapists, especially in rural or low-income areas. The U.S. has roughly 9 child psychiatrists per 100,000 youth, which is far below the estimated need of 47 child psychiatrists per 100,000 youth. This shortage delays treatment and increases crisis admissions. This shortage leads to long wait times and limited access to specialized care. Because of these gaps, there's a greater need for school-based and primary care screening. Early detection in schools and pediatric offices can help identify problems sooner and reduce pressure off the hospitals. Impact on the healthcare quality, client outcomes. There are many factors that can improve or negatively impact the client's overall care or outcome. The nurse should screen and assess for these factors. Early treatment improves social and academic success. Early intervention improves emotional regulation, school performance, and family functioning. Untreated conditions leads to long-term health care and behavior issues. Delayed or misdiagnosis leads to higher hospitalization rates and poorer long-term outcomes. Untreated disorders increase the risk of self-harm, substance abuse, chronic mental illness in adulthood. Health disparities persist for low-income and minority youth. The nurse should be culturally aware and use a family-centered care approach to enhance adherence and satisfaction. Nurses can improve the patient outcome by promoting screening, education, and follow-up care. Childhood mental health impact on safety. Client safety. Clients are at a high risk of self-harm, suicidal ideation, and poor coping skills. Family safety. Families experience stress, burnout, and financial strain caring for the children with complex needs. Healthcare professional safety. Healthcare professionals face compassion, fatigue, emotional distress, and ethical stress. Society safety. Bears long-term effects of violence, substance use, unemployment, and economic loss. The nurse's action should be to do a suicide risk assessment and a safety planning reduce risk for the patient. Financial costs of children's mental health disorders. Children's mental health disorders create a major financial burden for both families and the healthcare system. According to the CDC, pediatric mental health disorders cost the U.S. over $247 billion every year in treatments, hospitalizations, and special education services. Families often face out-of-pocket costs for therapies, medications, and missed work hours. Schools, hospitals also absorb expenses for the crisis care and behavior programs. Research by Hoffman shows that children from low-income and minority backgrounds face more barriers to early treatment, which increases long-term costs. Investing in early screening and prevention is more cost-effective and reduces emergency visits, hospitalizations, and improves quality of life for both children and families. Regulatory and policy factors for children's mental health. Several laws and policies play a key role in improving children's mental health care. Family and youth involvement policies encourages states to include families and young people in planning and decision-making for children's mental health services. This helps ensure care is more personal, culturally appropriate, and family-centered. The Affordable Care Act expanded behavioral health coverage, making mental health services an essential health benefit. This policy helped reduce financial barriers and increase access for many children and families. IDEA, or the Individuals with Disabilities Education Act, supports school-based mental health services by requiring schools to provide counseling and emotional support for students with behavioral and developmental needs. This law works together to promote early intervention, access, and equality in children's mental health care. Impact of policies and what's still needed. The policies we just discussed, like the Affordable Care Act, the IDEA, and the family and youth involvement policies have made a positive difference in children's mental health care. These laws have helped expand insurance coverage, increase access to school-based counseling, and encourage families to participate in treatment planning process. The Affordable Care Act, for example, made behavioral health services an essential benefit, which means that more children can now receive therapy and medication management. However, there are still important gaps that need to be addressed. Many areas, particularly rural and low-income communities, continue to face shortages of providers, lengthy wait times, and limited access to specialists. Funding and enforcement of these laws are inconsistent across states. Some schools lack sufficient counselors, and some insurance companies still make it difficult to attain full coverage for mental health services. There are also still stigma around seeking help, which prevents many families from using the resources that are available. Moving forward, we need stronger funding for school-based programs, better enforcement of parity laws, and more mental health education for families and communities. Nurses can play an active role in advocating for policy improvements, supporting early screenings for pediatric care, and helping families connect to available resources. Together, we can close the gap and ensure every child has access to quality mental health support. Role of the professional nurse. Nurses play an essential role in promoting children's mental health. We are often first to notice changes in a child's behavior or mood, which allows us to identify concerns early and connect families to resources before a crisis occurs. We also educate parents and teachers about recognizing warning signs and understand that mental health is just as important as physical health. Guided by the ANA Code of Ethics, nurses advocate for fair access, early screening, and cultural competent care. We work with schools, communities, and healthcare teams to reduce stigma and improve outcomes. The nurse should advocate for access and policy reform, educate families about coping and resilience, collaborate with schools and mental health professionals, promote early screening, and reduce stigma. Finally, I want to return to the idea I mentioned at the beginning, that early recognition and intervention can completely change the course of a child's life. Awareness and education helps reduce stigma and promote early screening. Nurses play a vital role in advocacy, education, prevention, and holistic care for young patients. By investing in childhood mental health today, we can build stronger, more resilient communities tomorrow. Thank you for listening, and I hope this presentation inspires each of us to be a part of the change that helps children grow into healthier, more resilient adults.